Have you ever dismissed constipation as just another inconvenient part of getting older? What if I told you that certain types of constipation could actually be warning signs of something far more serious, even life-threatening? For seniors especially, this common digestive issue might be silently signaling deadly conditions that modern medicine often overlooks until it's too late. Imagine this: an 82-year-old retired teacher notices increasing difficulty with bowel movements. She mentions it to her doctor, who simply suggests more fiber and water, standard advice we've all heard. 6 months later, she's diagnosed with advanced colorectal cancer that had been developing silently, with constipation as its earliest warning sign. Tragically, by then, the cancer had already spread. This isn't just a hypothetical scenario. It's happening to thousands of seniors every day across the country. The constipation they're experiencing isn't just uncomfortable, it's their body desperately trying to alert them to hidden dangers beneath the surface. So don't click away, watch until the very end, because what you learn today might save your life or the life of someone you love. I'll reveal the specific types of constipation that demand immediate medical attention, the deadly conditions they might be signaling, and most importantly, the simple at-home methods to determine whether your constipation is normal or a red flag requiring urgent care. Stay with me, because I'll also share remarkable stories of seniors who caught serious conditions early just by understanding the warning signs I'm about to reveal, including one 75-year-old man who detected a life-threatening intestinal blockage before it became an emergency, all because he knew what to look for. And if this topic resonates with you, I'd be incredibly grateful if you could take a moment to like this video. Your support helps spread this vital information to those who need it most. If you're not yet subscribed, be sure to hit that button and tap the bell so you never miss another potentially life-saving video. If you enjoy this content, comment 1 below, and if you think it could be better, type 0 so I know how to improve next time. Now, let's dive into the critical warning signs your body might be sending through what seems like ordinary constipation. Constipation affects nearly 35% of all adults over 60, making it one of the most common digestive complaints among seniors. But here's what most doctors won't tell you: constipation exists on a spectrum, and certain patterns aren't just normal aging but rather urgent warning signs of serious underlying conditions. When most people think of constipation, they imagine infrequent bowel movements or straining. But did you know there are actually different types of constipation, each with distinct characteristics and potential causes? Some forms are merely uncomfortable, while others serve as early warning signs of deadly diseases like colorectal cancer, intestinal obstruction, or even neurological disorders. What makes this especially dangerous for seniors is that constipation is so common it's often dismissed as just part of getting older. This dangerous misconception means many seniors and even their healthcare providers might ignore critical symptoms until a condition has progressed to a dangerous stage. The most alarming type is what medical professionals call new-onset constipation, a sudden change in bowel habits after age 50 that persists for more than 2 weeks. Studies have shown this specific pattern increases colorectal cancer risk by nearly 60% compared to those without such changes. Yet how many seniors or their caregivers recognize this crucial distinction? Another commonly overlooked pattern is alternating constipation and diarrhea, a telltale sign that something more serious than dietary issues might be at play. When this pattern includes unexplained weight loss, it can signal advanced intestinal disorders or even pancreatic disease, which has one of the lowest survival rates of any cancer. This isn't meant to frighten you, it's to empower you with knowledge that could quite literally save your life or the life of someone you care about. With the right information and simple monitoring techniques I'll share today, you can distinguish between ordinary constipation and symptoms that require immediate medical attention. Stick with me, because what I'm about to reveal may completely change the way you look at your digestive health. These aren't just alternative wellness theories, these are medically backed warning signs that too many doctors fail to emphasize to their senior patients. Let's take a moment to reflect on just how interconnected our digestive system is with our overall health. Your digestive tract isn't just a simple tube, it's a sophisticated system with intimate connections to your nervous system, immune function, and even brain health. This complex network is often called your second brain, and for good reason. It communicates crucial information about your well-being. When this intricate system sends warnings in the form of persistent constipation, it's not something to silence with over-the-counter laxatives. It deserves your attention and understanding. Think about that. Your body has evolved over millions of years to signal problems through symptoms. Yet in our modern world, we often rush to mask these vital messages rather than interpret them. During World War II, military doctors noticed something fascinating. Changes in digestive patterns often preceded serious illness in soldiers, sometimes appearing weeks before other symptoms emerged. They began monitoring these changes as early warning indicators, potentially saving countless lives through early intervention. This historical medical insight reminds us that our bodies often know something is wrong long before obvious symptoms appear. Now imagine applying the same vigilance to your own health or that of an elderly loved one. By recognizing the specific constipation patterns that signal danger, you could identify serious conditions at their earliest, most treatable stages. That's the power of the information I'm sharing today. If you're intrigued, you're not alone. Go ahead and type "Yes, I am" in the comments to let me know you're with me, and tell me where you're watching from so we can connect as we explore this more deeply. Let's start with one of the most alarming and frequently overlooked warning signs: the sudden onset of constipation combined with narrow, pencil-thin stools. Picture this: for decades, your digestive system has functioned predictably, perhaps not perfectly, but you generally knew what to expect. Then suddenly, in your 70s or 80s, something changes. Your bowel movements become increasingly difficult, and when they do occur, you notice the stool is unusually narrow, sometimes no wider than a pencil. While many might brush this off as another unwelcome aspect of aging, this specific combination, new constipation with pencil-thin stools, demands immediate medical attention. It could be signaling a narrowing in your colon caused by a growing mass or tumor that's literally creating a smaller passage for waste to move through. This narrowing, called a stricture, doesn't happen overnight. It develops gradually as abnormal cells multiply, creating a constriction that becomes more pronounced over time. In the early stages, you might not notice anything at all. As it progresses, stools become narrower while constipation worsens, a dangerous combination that too many seniors and even healthcare providers dismiss or misattribute to other causes. Colorectal cancer, which often begins as these abnormal growths, is the third most common cancer in adults over 65. What makes it particularly insidious is how treatable it is when caught early, yet how deadly it becomes when detected late. When identified at stage I, the 5-year survival rate exceeds 90%, but by stage 4, when the cancer has spread beyond the colon, that rate plummets to just 14%. This stark contrast illustrates why recognizing early warning signs is literally a matter of life and death. Unlike many other cancers, colorectal cancer typically grows slowly, providing a crucial window of opportunity for detection and intervention. But that window only matters if you know what you're looking for. Traditional medical wisdom often fails seniors by focusing exclusively on frequency, how often you're having bowel movements, rather than changes in the character or appearance of stools. This oversight means many seniors are told their constipation is normal without any examination of what their stools actually look like. Here's a simple way to monitor this at home. Pay attention not just to how often you're going, but also to the shape and width of your stools. If you notice a persistent narrowing over several weeks, especially in combination with increasing constipation, this isn't something to address with fiber supplements or laxatives. It requires prompt medical evaluation. And unlike many health screenings that require complex medical equipment, this simple observation could be the difference between catching a condition at its treatable stage or discovering it too late. Still watching this video and finding these insights helpful? I'd love it if you commented the number 1 below to let me know you're here. And if you haven't subscribed yet, now's the perfect time. Click that subscribe button and tap the notification bell so you never miss a video. Your support allows us to keep producing helpful, inspiring content that truly makes a difference. Now, let's move forward because I want to be honest with you, not everyone is immediately convinced that they should be concerned about certain types of constipation. My friend Richard is a perfect example. He's 72. A retired engineer who has always taken pride in his logical approach to problems. When he started experiencing increasing constipation along with occasional abdominal pain, he dismissed it as something that happens to everyone my age. 4 months, he tried over-the-counter remedies, adjusted his diet, and even joked about his plumbing problems during our weekly coffee meetups. The constipation would improve temporarily with laxatives, then return, a cycle that continued for nearly 6 months. What Richard didn't realize was that this pattern of constipation that temporarily responds to laxatives but keeps returning is actually a warning sign itself. It wasn't until his daughter, a nurse, visited for the holidays and noticed how frequently he was mentioning his discomfort that she insisted on a doctor's visit. The diagnosis shocked him: a significant intestinal obstruction caused by diverticulitis that had progressed to a dangerous level. The surgeon later told him he had been just weeks away from a potential emergency that could have been life-threatening. Today, after successful treatment, Richard has become an unexpected advocate for digestive awareness among his friends. "I almost died of embarrassment," he told me recently, "literally, because I was too embarrassed to talk seriously about my bathroom habits with my doctor." If you recognize yourself or someone you love in Richard's story, don't wait for a crisis. Type "Listen to Richard" in the comments as your personal reminder that monitoring these symptoms isn't overreacting, it's practicing smart, preventative healthcare. But here's the thing: abnormal stools and recurring constipation aren't the only red flags seniors should watch for. Let me ask you this: have you noticed constipation developing alongside unexplained weight loss? This combination represents another critical warning sign that should never be ignored. When constipation appears simultaneously with unintentional weight loss, typically defined as losing 5% or more of your body weight over 6 to 12 months without trying, it creates a concerning pattern that doctors recognize as a potential indicator of several serious conditions. One of the most concerning is pancreatic cancer, often called the silent killer because it frequently remains undetected until advanced stages. The pancreas is located deep within the abdomen, making early tumors difficult to feel during routine examinations. As the cancer develops, it can press against the digestive tract, slowing the movement of waste and contributing to constipation. Simultaneously, the cancer cells consume energy and disrupt normal metabolic processes, leading to unexplained weight loss even when appetite remains normal. What makes this combination particularly dangerous is how easy it is to attribute each symptom to benign causes. Weight loss might be dismissed as finally shedding those extra pounds, while constipation gets blamed on medication side effects or insufficient water intake. Only when viewed together do these symptoms reveal their potentially serious nature. Other serious conditions that can present with this combination include advanced colorectal cancer, ovarian cancer, and certain neurological disorders that impact both digestive function and metabolic rate. Each of these conditions becomes significantly more treatable when identified early, making recognition of this warning sign crucial. If you're experiencing both constipation and unexplained weight loss, don't wait for your next scheduled checkup. This combination warrants prompt medical evaluation. And for caregivers of seniors, be particularly vigilant about noting changes in both bathroom habits and weight. Keeping a simple journal can help identify patterns that might otherwise go unnoticed. The National Institute on Aging has found that seniors who monitor and report these combined symptoms improve their chances of early diagnosis by nearly 40% compared to those who report individual symptoms as separate concerns. That statistic alone should emphasize the importance of recognizing symptom patterns rather than isolated changes. Want a real-world example? Let me tell you about Eleanor, a vibrant 78-year-old retired librarian who had always been health-conscious. She noticed she was losing weight despite no changes to her diet, dropping from 145 to 132 pounds over about 4 months. Around the same time, she began experiencing increasing constipation that seemed resistant to her usual remedies of extra water and fiber. While each symptom on its own seemed merely annoying, the combination concerned her daughter, a regular viewer of health videos like this one. They sought medical attention, specifically mentioning both symptoms together. After appropriate testing, doctors discovered early-stage ovarian cancer that had been growing undetected for months. Because of their prompt action and Eleanor's awareness of her body's warning signs, her cancer was treated while still highly responsive to therapy. 3 years later, Eleanor is cancer-free and back to tending her beloved garden and volunteering at the local elementary school. If you're serious about protecting yourself or a loved one from similarly dangerous but detectable conditions, type prevention first in the comments below. Don't wait until symptoms become impossible to ignore. By then, precious treatment time may have been lost. But constipation's warning signals aren't limited to physical causes like cancer or blockages. Sometimes, persistent constipation can be your body's way of alerting you to neurological problems that affect the nervous system's ability to regulate digestive function. Parkinson's disease, for example, often manifests digestive symptoms years before the more recognized tremors appear. Studies show that up to 80% of Parkinson's patients experience severe constipation, often beginning up to a decade before diagnosis. This happens because the same neurological changes that eventually affect movement first impact the autonomic nervous system that controls involuntary functions like digestion. Multiple sclerosis, another neurological condition, can also present with severe constipation as an early symptom. The disease affects nerve signals throughout the body, including those controlling the coordinated muscle movements needed for proper bowel function. What makes these neurological connections particularly important for seniors is that constipation related to these conditions often has specific characteristics. It tends to be persistent despite dietary changes, develops gradually over months or years, and may be accompanied by other subtle symptoms like reduced sense of smell, slight coordination changes, or increasing fatigue. A groundbreaking study published in the Journal of Neurogastroenterology and Motility found that seniors who developed unexplained chronic constipation were over 3 times more likely to receive a Parkinson's diagnosis within 10 years compared to those without constipation. This striking connection underscores why digestive changes should never be dismissed as simply getting older. For caregivers and family members, being aware of this link is particularly crucial. The early stages of neurological disorders can be subtle, with the person affected often unaware of incremental changes in their functioning. Persistent constipation might be one of the few objective, trackable symptoms during this early period when intervention can be most effective. If you're still with me and finding this video helpful, Drop a comment with the number 2 below so I know you're with me. And if you haven't already, subscribe and turn on the bell icon to stay connected with future videos. Your support makes all the difference in allowing us to continue producing meaningful content designed to inform, heal, and inspire. Let's keep going, because the next warning sign might be the most underrated of all: constipation that develops or significantly worsens after starting new medications. Number 4, the medication connection that could save your life. Have you noticed constipation beginning shortly after starting a new prescription? Or perhaps your usual mild constipation suddenly became severe after a medication change. This timing isn't coincidental, it's a critical signal that your body might be experiencing a dangerous adverse drug reaction or potentially deadly drug interaction. While many medications list constipation as a possible side effect, what most seniors don't realize is that severe medication-induced constipation can sometimes progress to a life-threatening condition called ileus, a complete shutdown of normal intestinal movement. If left unaddressed, ileus can lead to intestinal perforation, sepsis, and even death. Certain medications carry particularly high risks. Opioid pain relievers, commonly prescribed for arthritis, back pain, or following surgery, are among the worst offenders. They slow the natural contractions of intestinal muscles, dramatically reducing waste movement through the digestive tract. When these medications are taken for extended periods, the resulting constipation isn't just uncomfortable, it can become dangerous. Other high-risk medications include certain blood pressure drugs, antidepressants, iron supplements, calcium channel blockers, and some Parkinson's medications. When these are combined, as they often are in seniors managing multiple conditions, the constipation risk multiplies. The danger escalates further with polypharmacy, the simultaneous use of multiple medications, which affects nearly 40% of seniors over 65. Each additional prescription increases not only the risk of constipation but also the severity and potential complications. What makes this particularly treacherous is how easily medication-induced constipation can be mistaken for other causes or dismissed as an acceptable trade-off for managing other health conditions. Too often, doctors add more medications to treat the constipation rather than reconsidering the original prescriptions causing the problem. Here's what you need to know: if severe constipation develops within weeks of starting a new medication, this isn't something to simply endure or treat with over-the-counter remedies. It requires prompt discussion with your healthcare provider about potential medication adjustments or alternatives that won't compromise your digestive function. A 2023 study in the Journal of the American Geriatric Society revealed that medication reviews prompted by new-onset constipation led to beneficial prescription changes in 67% of cases, often improving not just digestive symptoms but overall quality of life for seniors. Let me share what this looked like for my friend Thomas, a 77-year-old veteran who started taking a new blood pressure medication last year. Within 3 weeks, he developed severe constipation unlike anything he'd experienced before. Rather than simply adding laxatives to his daily regimen, his doctor recognized this as a potential medication reaction and switched him to an alternative blood pressure drug with fewer digestive side effects. The constipation resolved within days, but more importantly, this medication review revealed another potential interaction that could have caused serious heart rhythm problems if left undiscovered. What began as just constipation ended up preventing a potentially dangerous cardiac complication. If you're taking multiple medications and experiencing worsening constipation, type "check my meds" in the comments to remind yourself to discuss this specific concern with your healthcare provider. This simple step could prevent dangerous complications while potentially improving your overall treatment plan. Now, for one of the most urgent warning signs: constipation accompanied by severe, constant, or worsening abdominal pain. Number 5, the pain signal that requires immediate attention. We've all experienced occasional abdominal discomfort with constipation, the fullness, bloating, or cramping that typically resolves once the bowels move. But there's a critical distinction seniors need to understand: when constipation occurs alongside severe, persistent, or increasingly intense abdominal pain, it could signal a medical emergency requiring immediate attention. This combination can indicate several dangerous conditions, including intestinal obstruction, volvulus, a twisting of the intestine, or even intestinal perforation, all of which can become life-threatening within hours if left untreated. The risk for these acute digestive emergencies increases dramatically with age. After 70, the intestinal tissues naturally become less elastic and more vulnerable to twisting, tearing, or becoming blocked. Previous abdominal surgeries, which many seniors have undergone, create adhesions, internal scar tissue, that further increase these risks. What makes this warning sign particularly dangerous is how it can be confused with more benign causes of pain. Many seniors mistakenly attribute severe abdominal pain to bad gas, severe constipation, or stomach flu, leading to dangerous delays in seeking medical care. Here's a critical guideline: if constipation is accompanied by severe pain that persists for more than 2 hours, especially if accompanied by vomiting, fever, or an inability to pass gas. Do not wait, seek emergency medical attention immediately. These symptoms together could indicate a bowel obstruction or perforation, conditions with mortality rates that increase significantly with each hour treatment is delayed. A recent study from the Mayo Clinic found that seniors who waited more than 12 hours to seek care for these symptoms had nearly triple the complication rate compared to those who obtained help within the first 6 hours. This statistic dramatically illustrates why distinguishing ordinary constipation discomfort from emergency warning signs is literally a matter of life and death. Let me tell you about Frank, an active 84-year-old who woke up one morning with severe constipation and unusual abdominal pain. Having watched videos like this one, he recognized that the intensity of his pain combined with his complete inability to pass gas wasn't normal constipation. Instead of waiting it out, as he might have done previously, he called for emergency help. At the hospital, doctors discovered he had a sigmoid volvulus, a dangerous twisting of the lower part of his colon that cuts off blood supply to the intestine. Without prompt treatment, this condition can cause tissue death, perforation, and potentially fatal infection. Because Frank recognized the warning signs and acted quickly, doctors were able to correct the problem before permanent damage occurred. If you're ready to be vigilant about these warning signs for yourself or a loved one, type emergency aware in the comments. This knowledge of when to treat constipation as a potential emergency rather than a simple inconvenience could save your life or the life of someone you care about. Now that we've covered the most dangerous warning signs, let's talk about a practical tool you can use at home to monitor and evaluate constipation symptoms: the Bristol Stool Chart, a visual scale that helps classify stool appearance and what it might indicate about your digestive health. Number 6, the simple chart that could save your life. The Bristol Stool Chart isn't just a medical curiosity, it's a powerful diagnostic tool that can help seniors and caregivers determine when constipation might signal something more serious. Developed by researchers at the Bristol Royal Infirmary, this chart classifies stool into 7 types, ranging from separate hard lumps, type 1, to entirely liquid, type 7. For monitoring constipation, types 1 and 2 are most relevant. Type 1 resembles separate hard lumps, like nuts, that are difficult to pass. Type 2 appears as sausage-shaped but lumpy. Both indicate significant constipation, but persistent type 1 stools especially deserve medical attention, as they suggest severe slowdown in intestinal movement. Beyond just identifying constipation, tracking changes on the scale over time can reveal patterns that might otherwise go unnoticed. For example, a gradual shift from normal stools, types 3 to 4, to consistently hard stools, types 1 to 2, over several months might indicate a slowly growing blockage or neurological changes affecting the digestive tract. Many gastroenterologists now recommend that seniors, particularly those with chronic health conditions or on multiple medications, keep a simple stool diary using the Bristol Stool Chart. This doesn't require detailed descriptions, just noting the date and corresponding stool type number creates an objective record that can be invaluable during medical consultations. A study published in the Journal of the American Geriatric Society found that seniors who maintained such records for 3 months were able to identify problematic patterns nearly 70% more accurately than those relying on memory alone when discussing symptoms with healthcare providers. You can easily find printable versions of the Bristol Stool Chart online, or even smartphone apps designed specifically for this purpose. Keeping this record might seem unusual at first, but the medical insights it provides could quite literally save your life by identifying dangerous patterns before they progress to emergencies. Martha, a 79-year-old grandmother, started keeping such a record after her sister was diagnosed with colorectal cancer. Over 3 months, she noticed her stools gradually moving from type 4, normal, to consistently type 1, severely constipated, despite no changes in diet or medication. When she shared this documented pattern with her doctor, it prompted immediate testing that revealed a precancerous polyp that might otherwise have gone undetected until much later. If you're committed to monitoring your digestive health with this level of attention, type "charted" in the comments. This simple tracking method could provide the early warning you need for timely intervention. So far, we've focused on recognizing dangerous warning signs, but what about practical solutions for addressing constipation safely while monitoring for these red flags? Let's talk about the safest, most effective approaches specifically for seniors dealing with constipation. Number 7, the safest relief strategies for seniors. When it comes to managing constipation in seniors, not all approaches are equally safe or effective. In fact, some common remedies can actually mask warning signs or create new problems of their own. Here's what you need to know about finding relief without compromising your ability to monitor for dangerous symptoms. First, let's address hydration, the foundation of healthy bowel function. As we age, our sense of thirst naturally diminishes, leading many seniors to become chronically dehydrated without realizing it. Studies show that simply increasing water intake to at least 6 to 8 glasses daily resolves mild to moderate constipation in nearly 35% of seniors. But it's not just about quantity, timing matters too. Drinking a full glass of warm water first thing in the morning stimulates the gastrocolic reflex, a natural response that triggers bowel activity. Adding a squeeze of lemon enhances this effect by stimulating bile production, which helps move waste through the intestines more efficiently. Physical activity, even gentle movement, is another powerful constipation reliever that's especially effective for seniors. Walking for just 15 to 20 minutes after meals significantly increases gut motility, the natural contractions that move waste through your digestive tract. For those with mobility limitations, seated exercises that involve gentle twisting motions can help stimulate intestinal movement. Dietary fiber deserves special attention, as the type of fiber matters tremendously. Insoluble fiber, found in wheat bran and many vegetables, adds bulk to stool but can actually worsen constipation if not accompanied by sufficient water. For seniors, soluble fiber sources like ground flax seeds, chia seeds, and psyllium husk are often more effective as they absorb water and create a gel-like substance that's easier to pass. A particularly effective approach combines 1 to 2 tablespoons of ground flaxseed with 6 ounces of prune juice. This provides both immediate stimulation from the prune juice and longer-lasting benefits from the flax seed's fiber and natural oils. Many seniors find this combination works more gently and reliably than commercial laxatives. Speaking of laxatives, a word of caution is necessary. While over-the-counter laxatives provide temporary relief, regular use can create dependency as your intestines begin to rely on artificial stimulation. More concerning for our discussion, laxatives can mask important warning signs by artificially producing bowel movements despite underlying problems. If laxatives are necessary, osmotic types like Miralax, polyethylene glycol, tend to be gentler and safer for seniors than stimulant laxatives. However, even these should be used sparingly and under medical supervision, particularly for seniors with heart or kidney conditions. For those seeking natural approaches, certain herbal teas show impressive effectiveness. Particularly notable is senna tea, which contains natural compounds that gently stimulate intestinal contractions. Ginger tea offers another option, especially beneficial because it also reduces inflammation that might be contributing to digestive slowdowns. Probiotics represent another promising approach, particularly for seniors taking antibiotics or those with recurring constipation. These beneficial bacteria help maintain the gut microbiome, the complex ecosystem of microorganisms that plays a crucial role in digestive health. Specific strains like Bifidobacterium lactis and Lactobacillus acidophilus have shown particular promise for improving constipation in older adults. A technique that combines several of these approaches has shown remarkable results for my friend Julia, a 76-year-old artist who struggled with chronic constipation for years. Every morning, she drinks warm water with lemon juice followed by a small bowl of yogurt mixed with ground flaxseed and a drizzle of olive oil. After breakfast, she takes a 15-minute walk around her neighborhood. This simple routine has transformed her digestive health, eliminating the need for laxatives she once depended on. If you're ready to try a gentler, more natural approach to managing constipation, type "natural relief" in the comments. These methods not only provide effective relief but also allow your body to communicate important warning signs if something more serious develops. Now that we've covered both warning signs and safe management strategies, let's discuss when it's absolutely essential to seek medical care, the non-negotiable situations where waiting or self-treating is simply too dangerous. Number 8. When to call the doctor immediately. While many cases of constipation can be addressed through the strategies we've discussed, certain scenarios require immediate medical attention. Understanding these situations could quite literally save your life or the life of a senior you care about. First and foremost, any constipation accompanied by severe or persistent abdominal pain, especially if the pain is concentrated in one area or consistently worsening, requires emergency evaluation. This combination could indicate a bowel obstruction, perforation, or other acute condition that can rapidly become life-threatening. Similarly, constipation with vomiting, especially vomiting that smells like feces, represents a medical emergency. This symptom, called fecaloid vomiting, suggests complete intestinal obstruction and requires immediate surgical intervention. Even vomiting without this characteristic but persistent alongside constipation warrants urgent care. Fever combined with constipation is another red flag, potentially indicating infection either causing or resulting from the constipation. In seniors, infections can escalate quickly and may not present with the same obvious symptoms seen in younger adults. Any fever above 104 degrees Fahrenheit 38 degrees Celsius in conjunction with severe constipation should trigger a call to your doctor or a trip to the emergency room. Blood in the stool or on toilet paper, especially if dark or mixed with mucus, requires prompt medical evaluation. While small amounts of bright red blood might result from hemorrhoids, darker blood or larger quantities could indicate more serious conditions ranging from inflammatory bowel disease to colorectal cancer. Sudden constipation developing after age 50 without any clear cause, like medication changes or dietary shifts, should be evaluated within 2 weeks, not months. This new-onset constipation carries a higher risk of indicating serious underlying conditions than lifelong or occasional constipation. Unexplained weight loss occurring alongside constipation, as we discussed earlier, demands medical attention within days, not weeks. This combination significantly increases the likelihood of conditions like cancer, which become more treatable the earlier they're detected. Substantial changes in stool caliber, particularly narrowing to pencil-thin width that persists across multiple bowel movements, requires evaluation within 2 weeks. This change specifically can indicate growths narrowing the intestinal passage. Finally, constipation that completely fails to respond to home remedies for more than a week, especially in someone who hasn't previously experienced chronic constipation, should prompt medical consultation. This stubborn pattern might indicate issues beyond simple functional constipation. If you're still with me and finding this video helpful, please comment the number 3 below to let me know. And if you haven't already subscribed and hit the notification bell, please do so now. I want to emphasize that seeking medical help for these warning signs isn't overreacting, it's practicing smart preventative healthcare. Too many seniors delay necessary care out of embarrassment about discussing digestive issues, concern about being perceived as hypochondriacs, or simple stoicism about discomfort. Robert, an 81-year-old retired professor, represents this tendency perfectly. Despite 2 weeks of progressively worsening constipation and increasing abdominal pain, he kept insisting he could handle it with home remedies. It wasn't until his daughter noticed he couldn't stand fully upright from pain that she insisted on taking him to the emergency room. Doctors discovered he had diverticulitis with a forming abscess that could have ruptured without treatment. After appropriate antibiotics and drainage, he recovered fully, but his doctor emphasized that waiting even another day could have led to a life-threatening situation. If you recognize this reluctance to seek help in yourself or someone you love, type "no more delays" in the comments as a personal commitment to taking these warning signs seriously. Remember, prompt medical attention for concerning symptoms isn't weakness, it's wisdom. As we near the conclusion of our discussion, I want to emphasize something crucial. While constipation can indeed signal serious conditions, most cases are manageable and don't represent emergencies. The key is knowing the difference between ordinary constipation and warning signs that demand attention. Let's recap the critical warning signs we've covered. 1. New-onset constipation after age 50, especially when persistent. 2. Pencil-thin stools combined with increasing constipation. 3. Constipation with unexplained weight loss. 4. Severe constipation developing after starting new medications. 5. Constipation with severe or persistent abdominal pain. 6. Blood in the stool accompanying constipation. 7. Constipation with vomiting or fever. 8. Constipation that completely fails to respond to home remedies. For safe management of ordinary constipation, remember these key strategies. 1. Maintain proper hydration with at least 6 to 8 glasses of water daily. 2. Incorporate appropriate fiber, particularly soluble types like flaxseed. 3. Stay physically active with daily walking or gentle exercise. 4. Consider natural supplements like magnesium before stronger laxatives. 5. Track your patterns using the Bristol stool chart. 6. Discuss medication adjustments with your doctor if constipation develops after starting new prescriptions. Your digestive health is too important to ignore or dismiss changes as simply getting older. The digestive system, with its complex network of nerves, muscles, and tissues, often serves as an early warning system for your entire body. Learning to interpret these signals could be one of the most important health skills you develop. As you age, your body may not communicate problems in the same ways it once did. Pain may be less severe. Inflammation may manifest differently, and problems may develop more gradually. This changing communication style makes it even more important to pay attention to persistent or unusual symptoms like the constipation warning signs we've discussed. Many seniors who've implemented the monitoring and management strategies we've covered report not just better digestive health, but greater peace of mind knowing they can distinguish between ordinary constipation and potentially dangerous warning signs.